Okay, so I chose my topic to be over the effects of canine assistance for military veterans who have PTSD. My article is called Military Veterans and Canine Assistance for Post-Traumatic Stress Disorder, a narrative review of the literature. It is by Cheryl Crosperello, Sarah Sarney, Eleni Patton, and summarized by me. And this article is back from 2016. So the introduction starts as explaining what PTSD is. Most of y'all probably know, but it is a major problem in the US today with veterans. And the symptoms can include re experiencing traumatic events, anxiety, and avoidance behavior. This also can lead to aggressiveness and suicide. It is a common disease, but there's still no perfect treatment. They have tried therapies, group therapies, and the problem is still very prevalent. Canine assistance is thought to be a possible treatment due to a canine's natural temperament of being a sweet and friendly animal. They have ability to be an alert system, and they can help veterans who feel isolated socialize out in the world, and they can calm them down with like their touch or just even their presence. They have been known to help people with depression and anxiety in the past, so that's why it's seen as a possible treatment. The article discusses whether or not canine assistance is proper treatment for veterans with PTSD. And there have been some publications about this topic, but during the research, only 6 articles were shown to be helpful. And they would use keywords and use 4 research questions to determine the right articles and to determine if it is a helpful treatment. Like I said, their process of methods was 4 research questions. These questions were: what is the definition of canine assistance? What are the benefits? What are the concerns? And what future directions are needed? These questions were answered by searching databases and finding common themes. So then you go into the findings. There were many findings, including the types of canine animals, the 2 benefits, and the 3 concerns, and where to go. The 4 different kinds of canine assistance animals are service dogs, therapy dogs, emotional support dogs, and companion dogs. Um, Service dogs and emotional support dogs and therapy dogs are probably best suited for veterans with PTSD. Service dogs being the best because they are allowed in public places and they are specifically trained for a certain person's needs. A therapy dog has more emotional help for people. They're the ones that would go into like hospitals or nursing homes and just like help make them feel better. And they are allowed in some places, but not like everywhere, like service dogs are. And then emotional support dogs have no previous training, and they're just it's just the relationship between the owner and the dog. And then same with companion dogs. Um the 2 benefits were social benefits and psychological benefits. The social benefits are that they are able to help with basic functions and coping. So this can help them re-enter life after war and help them make friends, feel a part of the society, and calm them down. The psychological benefits were shown to increase the release of oxytocin, and oxytocin is what goes in your brain, and it's the good thing. And so with this, they say that they did studies, and when a person sees an animal, they have a certain release of oxytocin, which makes them happy. The 3 concerns were the animal's welfare, the best practices, and then the cost. The cost for a service dog is very expensive, and some veterans who come back from war do not have those funds. So their fix on this would be maybe adoption or a volunteer training program where they have volunteer trainers who speak one-on-one with the veteran and they work together to help train the service dog. It has not been proven whether the canine can gain the symptoms of PTSD in the social in the aspects of the animal's welfare. Um, it's not shown that they can be affected, but people do have this theory, and it's more about the dog's ability to get proper sleep, proper care, because they will be working a lot. So if they ever have downtime is the problem. And then um the problem with the studies available is that they only focus on the mild stressors. So therefore it's uncertain whether canine assistance is the perfect treatment because veterans can suffer from trauma stressors and they can lead to extreme aggressiveness, and no one knows like if the extreme aggressiveness can be calmed down yet. In conclusion, veterans suffering from PTSD is a problem that not enough people are trying to fix. And canine assistance is promising, but overall, there's not enough research to know for sure. What's needed is collaboration between researchers, patients, and canine trainers in order to further along the research. And future studies should focus on finding the best practice, minimizing the obstacles that were listed, and focusing on the animal's welfare. And my references were from Presence of a Dog Reduces Suggestive but Not Psychological Stress Responses to an On-Long Trauma by Loss Hennen and Peck, Streb, and Michael. And then my second reference is by Yount, Ritchie, St. Laurent, and Chumley, and it's called The Role of Service Dog Training in the Treatment of Combat-Related PTSD. So, yes, overall, there needs to be more research conducted, but from research that we do have, it seems like canine assistance can be a really good therapy method for veterans suffering with PTSD.